Arthritis is a common health problem that affects millions of people around the world. It is a condition that causes pain, stiffness, and swelling in the joints. Arthritis can affect people of all ages, including children. There are many different types of arthritis, but the most common types are osteoarthritis and rheumatoid arthritis. Living with arthritis can be challenging. The pain and stiffness can make it difficult to do everyday activities, such as walking, dressing, and cooking. Arthritis can also make it difficult to sleep, which can lead to fatigue and mood changes. People with arthritis may also experience anxiety and depression due to the impact of their condition on their life. It's important to remember that arthritis is a manageable condition. With the right treatment and support, people with arthritis can live full and active lives. If you are experiencing joint pain, stiffness, or swelling, it is important to see a doctor to get a diagnosis and discuss treatment options. Osteoarthritis is the most common type of arthritis. It is a degenerative condition that occurs when the cartilage that cushions the joints breaks down. Cartilage is a tough, slippery tissue that allows bones to move smoothly over each other. When cartilage breaks down, the bones rub together, causing pain, stiffness, and inflammation. Osteoarthritis most commonly affects the joints that bear weight, such as the hips, knees, and spine. It can also affect the fingers, thumbs, and neck. Osteoarthritis is more common in older adults as cartilage naturally wears down with age. However, it can also occur in younger people, especially those who have had joint injuries. Symptoms of osteoarthritis often develop gradually over time. The most common symptom is pain that worsens with activity and is relieved by rest. Other symptoms include stiffness, swelling, and a grinding sensation in the joints. In the early stages of osteoarthritis, pain may be mild and only occur occasionally. As the condition progresses, pain may become more severe and constant, making it difficult to perform daily tasks. Rheumatoid arthritis, or RA, is an autoimmune disease. In autoimmune diseases, the body's immune system, which normally protects against foreign invaders like viruses and bacteria, mistakenly attacks its own tissues. In the case of RA, the immune system attacks the lining of the joints, causing inflammation, pain, stiffness, and swelling. Over time, this inflammation can damage the cartilage and bones in the joints. The exact cause of rheumatoid arthritis is unknown, but it is believed to be triggered by a combination of genetic and environmental factors. Rheumatoid arthritis is more common in women than men. It typically develops between the ages of 30 and 50, but it can occur at any age. Unlike osteoarthritis, which typically affects joints on one side of the body more than the other, rheumatoid arthritis tends to affect joints symmetrically. This means that if one wrist is affected, the other wrist is likely to be affected as well. Along with joint pain, stiffness, and swelling, people with rheumatoid arthritis may also experience fatigue, fever, and loss of appetite. Juvenile idiopathic arthritis, or JIA, is the most common type of arthritis in children. It is a group of arthritis conditions that cause joint inflammation in children. The symptoms of JIA are similar to those of adult arthritis, but they may be more severe and can affect a child's growth and development. There are several subtypes of JIA, each with its own unique characteristics. Some of the most common subtypes include oligoarticular JIA, which affects 4 or fewer joints, polyarticular JIA, which affects 5 or more joints, and systemic JIA, which affects the entire body. Treatment for arthritis focuses on relieving pain, reducing inflammation, and improving joint function. Treatment options for arthritis vary depending on the type of arthritis, the severity of symptoms, and the individual's overall health. Common treatments for arthritis include medications such as pain relievers, anti-inflammatories, and disease-modifying anti-rheumatic drugs or DMARDs, physical therapy to help maintain joint mobility and strength, occupational therapy to assist with daily activities, and surgery such as joint replacement may be necessary in some cases. It is important to seek medical attention if you suspect you or your child may have arthritis. Early diagnosis and treatment can help prevent joint damage and improve long-term outcomes.